Hey everyone, it's Micah Handell with Handell Insurance. Today, we're talking about having both Medicare and Medicaid. So today, we're going to break it all down in plain English. Let's get into it. Medicare is a federal health insurance program, and it's mostly for people that are 65 and older, some folks that are 65 and under with long-term disabilities, and anyone who has end-stage renal disease or ALS. Think of Medicare as your health coverage toolbox. It's made up of 4 different parts. Part A, hospital coverage. Think hospital stays, skilled nursing, hospice. Part A is usually free if you've worked enough quarters. Part B is outpatient services. This is doctor visits, lab work, preventative services. This one comes with a monthly premium. 2025, it's $185 a month. Part D is prescription drug coverage. This one is run by private insurance companies. And finally, we have Part C, aka Medicare Advantage. This is a bundled plan from private insurance companies where you receive your Medicare Parts A, B, and usually D through an insurance company's HMO or PPO plan in your area. The big thing to know about Medicare is that it's the same in all 50 states. Rules don't change depending on where you live, although the plans. What is Medicaid? Medicaid is a joint state and federal program for people with low income. It generally supports children, pregnant women, people with disabilities, and seniors. Here's the twist. Every state runs its own version of Medicaid. This means that the rules, benefits, eligibility, and even the name of the program can vary state by state. One state might call it Medi-Cal, another state might just call it medical assistance. Here's why all this matters. Medicaid pays for things that Medicare doesn't. Things like long-term care and nursing home care. Sometimes dental and vision, although that can vary widely by state. Non-emergency medical transportation is usually covered by Medicaid. Medicaid can even pay your Medicare copays and coinsurance if you qualify. So let's make it all crystal clear and see how they compare. Medicare is run by the federal government and Medicaid is run by your state. Medicare is for people that are over 65 and for people under 65 with certain disabilities. Medicaid is based on your income and assets and varies by state. Medicare only covers short-term stays in skilled nursing facilities and does not cover long-term care. Medicaid does cover long-term care, including nursing home care. Medicare pays first, and Medicaid covers your Medicare's copays and coinsurances if you have full Medicaid. Medicare has the same rules across the country, and Medicaid rules vary depending on what state you live in. So, if you have both Medicare and Medicaid, you're known as what's called dual eligible. It means you have Medicare and Medicaid working together. And while this gives you a ton of coverage, it also adds some complexity. The rest of this guide and YouTube series is here to help you make sense of it, maximize your benefits, and avoid the traps that cost people time and money and energy every year. I've linked a copy of the Medicare and Medicaid Survival Guide so you can download it for free in the description. If you found this video helpful, hit the like and don't forget to subscribe. Drop a comment in the comment section and we'll answer those questions in the following videos. Thanks so much for watching, and I'll see you in the next one.